Premenopausal is when you're having regular menstrual periods and you're fertile. Perimenopausal is the transition between premenopausal and menopause. Menopause is defined as having your final menstrual period, and usually you can only make that diagnosis retrospectively when you haven't had a period for 12 months. The menopause transition is one of the more difficult periods of life to both diagnose and to treat. The changes can be rather subtle. So on one day you may have breast tenderness and nausea, and on a different day you may have hot flashes and vaginal dryness. And associated with that can be some emotional lability you're not used to, brain fog. You might have even joint aches and pains. So when you start having these symptoms, they're not necessarily every single day, but they kind of creep into your life, and it's all perimenopausal. Hormone therapy is really curative of these symptoms and can improve the quality of life immeasurably. Hormone replacement therapy is giving the patient back hormones that the ovaries are no longer making. In a normal menstrual period, the ovaries will make estrogen all cycle long, and they make progesterone for 2 weeks out of that cycle. The treatment ends up replacing those hormones, particularly estrogen, which we know is very effective in treating hot flashes, night sweats, corrects vaginal dryness, corrects pain with intercourse. The only caveat we have to consider is if you haven't had a hysterectomy, you also need to add back in the progesterone. One of the reasons that more women don't opt for hormone therapy is they're afraid of the risks. The risk of breast cancer associated with hormone therapy is rare. Even though it's increased in women that take estrogen and progesterone, it means only a single additional case of 1 case per 1,000 women per year. So that's pretty negligible risk. It's a safe intervention that can do an awful lot of good. You can literally give them their life back.